Teralogy of Fallot is a combination of 4 congenital heart defects that affect infant and children. The 4 defects are ventricular septal defect, pulmonary stenosis, right ventricular hypertrophy, and overriding of aorta. Normally, oxygen-poor blood returns to the right atrium from body, travels to the right ventricle, and then is pumped through pulmonary artery into the lungs where it receives oxygen. Oxygen-rich blood then returns to the left atrium from lungs, passes through the left ventricle, and then is pumped through aorta out to the body. In babies with Teralogy of Fallot, this normal circulation varies because of 4 defects. Pulmonary stenosis. It refers to narrowing of pulmonary valve in the heart, which is responsible for the flow of blood from lower right chamber into the artery that supplies blood to the lungs. Ventricular septal defect. The ventricular septum is a wall in the heart that separates the two sides. The bottom left side of heart, which stores oxygen-rich blood, and the bottom right side of heart, which stores oxygen-poor blood. The septal wall stops the two types of blood from mixing. A ventricular septal defect is a hole in the septum wall which causes mixing of oxygen-rich blood and oxygen-poor blood. Right ventricular hypertrophy refers to the thickening of muscles in the walls of lower right chamber of the heart. This is due to heart have to work extra hard to pump blood through the narrowed pulmonary valve and extra flow of blood coming through the ventricular septal defect. Overriding of aorta. The aortic valve is typically on the lower left chamber of the heart and is responsible for flow of oxygen-rich blood to the rest of the body. When person is having Teralogy of Fallot, the aortic valve is in between the lower left and right chamber of the heart next to the ventricular septal defect. This causes oxygen-poor blood to flow through the aortic valve instead of oxygen-rich blood. The symptoms of Teralogy of Fallot may vary and can range from mild to severe. They may be present from birth. The most common symptom is bluish coloring to the skin, particularly lips, tongues, and hands. This is due to the lack of oxygen in the blood. Other symptoms can include difficulty in breathing, especially after or during physical activities, tiring easily, dizziness, slow weight gain, slow physical growth, poor appetite, hypercyanotic attack, which causes person to suddenly become extremely blue or pale than usual, fainting and experiencing a seizure. A healthcare professional do not know exact cause of Teralogy of Fallot in many babies. However, there are some risk factors that have been associated with the condition. This include family history, maternal alcoholism, drug abuse or smoking, maternal diabetes, maternal age above 40, and poor parental diet. Doctors can diagnose Teralogy of Fallot during maternal ultrasound before birth, and after birth it can be done through physical examination, echocardiogram, ECG, chest X-ray which shows boot-shaped heart because of the hypertrophy of right ventricle, cardiac catheterization, CT scan or MRI. All the children with Teralogy of Fallot need to have surgery to fix it. Most children have it done before they turn 1 year old. There are 2 surgical options, the complete repair and temporary or palliative surgery. The complete repair, the surgeon widens the passageway between the right ventricle and pulmonary artery to improve the blood circulation to the lung. The ventricular septal defect is patched to stop the mixing of oxygen-poor and rich blood. This repair will also fix the 2 remaining defects because ventricles does not have to work too hard to pump the blood into the lungs. And patched ventricular septal defect prevent the blood with low oxygen to flow into the aorta. Temporary or palliative surgery. This is usually done only when baby is too weak or too small to have surgery. The surgeon creates secondary route for the blood to travel to the lungs for oxygen supply by placing a small tube called a shunt between the large artery branching off the aorta and pulmonary artery. The full repair is done later when the baby grows stronger.